Asthma is a disease of the bronchial tubes or airways. The symptoms are a feeling of tightness in the chest, wheezing, shortness of breath, and coughing. It is a chronic illness, meaning there is no cure for the disease. Therefore, it is important to understand what triggers asthma so that it can be better managed. In this video, the first of 2 parts, we will be exploring the various triggers of an asthma attack, what happens during an attack, and some of the ways in which the disease can be treated with the use of herbs. In part 2 of this video, we will examine treatments with the use of water. While most people, healthcare providers and patients alike, use the umbrella term asthma, it's not a one-size-fits-all disease. There are multiple types of asthma, and each type has different triggers, events, or things in the environment that can set off an asthma attack. The most common types include allergic asthma. If your asthma symptoms are triggered by an allergic reaction, this is called allergy-induced or allergic asthma. Allergic asthma is very common, and the type most likely to affect children. Inhaled allergens that may trigger your asthma include dust mites, pollen, and pet dander. There are a few less common allergens that can cause an asthmatic reaction as well. They include cockroaches, eggs, milk, peanuts, shellfish, tree nuts, wheat. Non-allergic asthma. Someone with this type of asthma doesn't have allergic triggers, but they do react to a variety of other environmental factors they come in contact with, including food additives, such as MSG and food coloring, irritants in the air, like smog, paint fumes, gasoline, charcoal grills, tobacco smoke, medications, including aspirin, nonsteroidal anti-inflammatories, NSAIDs, and beta blockers, stress and strong emotions, such as anger, fear, or excitement, viral respiratory infections like the cold or flu, weather conditions, like dry wind, thunderstorms, or cold air. Exercise-induced asthma. Ironically, the very thing you do to improve your lung capacity is the same thing that may temporarily mess with your breathing. Exercise, especially when done in cold air, can exacerbate inflammation and increase asthma symptoms. This doesn't mean you can't work out or play sports, however. With proper treatment and good asthma control, you should be able to continue any physical activity you enjoy. Occupational asthma. People who work in certain fields may develop asthma symptoms due to triggers in their workplace. These triggers include chemicals used in manufacturing, dusts from wood, grain, or flour, some molds, animals and insects, cleaning products, and latex material. Workers in these fields are at higher risk. Nocturnal asthma. This type of asthma has a variety of triggers, but the hallmark is that symptoms are especially bad at night, robbing patients of sleep. If you find yourself waking up in the middle of the night because of coughing and wheezing, or shortness of breath, or if falling asleep is a challenge because of your rapid breathing, talk with your doctor about nocturnal asthma. What's most important is knowing your individual triggers, so you can avoid them and keep your asthma under control. So what is an asthma attack? It usually starts with a cough or a wheeze, resulting from the tightening of the chest. Soon you start feeling stiffened from the lock of air, which cause your breathing to speed up and get shallower. Does this sound familiar? This is what happens in a typical asthma attack. It is a disease that narrows the airway. Normally air flows freely through your trachea, then through large tubes called your bronchi, smaller tubes called bronchioles, and then into tiny sacs called alveoli. Asthma affects primarily the smaller airways, the bronchi and bronchioles. These airways have an inner lining called the mucosa, which is surrounded by a smooth muscle. These muscles tighten during an asthma attack and the airway walls become more swollen. The airways also produce thick mucus that narrows them even more, making it even harder to breathe. If you are troubled with asthma, your doctor may prescribe a pump called a bronchodilator to alleviate the effect of the condition. This medication will reduce the mucus secretion in the airways, relax the muscle constriction surrounding the airway walls, by reducing the inflammation in the airway. Herbal treatments seek to attain the same relieving effects, so here are some of the herbs you can use to achieve this. 1. Talampune leaves. Roll 2 dried leaves. Use this as cigarette every 6 hours. 2. Kalatsutsi leaves. Roll 2 dried leaves. Use this as cigarette, 1 in the morning and 1 in the evening. 3. Sampalak bark. Chop and boil 1 foot-long piece of bark in 3 glasses of water for 10 minutes. Dosage. Adults, 1 cup after each meal and at bedtime. Children, ½ cup, 4 times a day, after meals and at bedtime. Babies, 2 teaspoons 4 times a day, after meals and at bedtime. 4. Colitis leaves and flowers. Boil 5 chopped young stems with flowers and leaves in 5 glasses of water for 10 minutes. Dosage. Adults, 1 cup 4 times daily. Children, ½ cup, 4 times a day. Babies, 2 teaspoons 4 times a day. This treatment is especially good for excessive mucus discharge. Since there is no cure for asthma, the goal is to prevent the attacks, or reduce its severity. Hope you found this video helpful. Please subscribe and hit the notification bell so that you don't miss the treatment of asthma using water therapy, or any future health and wellness releases.